As someone who lived through childhood in a household impacted by substance abuse and whose mental health struggles went unrecognized until adulthood, I'm interested in what supports are in place now for children of parents with substance use disorder in New York State. What early intervention programs, mental health screenings, peer support, or family counseling services does OASIS provide specifically for minors, and how accessible are they?
So, to start with, I would say is the work that we're doing in the school. And so we're doing that again with OMH as well, in their school-based clinics, and working together to do, to both provide the mental health services and then to sort of screen for and, work on prevention for substance use. We also have youth clubhouses, as I mentioned before, and recovery centers. And so those youth clubhouses are, specifically for young people to be able to provide the support and the safe space to have discussions about what they're going through and what's going on in their families. I think in terms of the gaps that you asked about, stigma, as I mentioned, is a big issue that we're really trying to address. Making sure that our services are culturally responsive.
Another follow-up question I had that just came up as you were answering my initial question is when you talk about those gaps of service and reaching people outside of maybe like the general areas where they would receive support. So for me, I was homeschooled. I really like that you touched on the importance of getting into the classrooms and the school district setting, but also there are students and there are people who don't have access to those areas. I also grew up in a Muslim household, and I think sometimes interfaith outreach is overlooked. So I was wondering if there's anything you could say to that.
That's a great point. That's actually exactly an area we're looking into right now, and we've started doing work in that. So I totally appreciate that comment. I think, and this again is part of the stigma work, because we know that faith-based organizations are really important in communities, and can reach people that we wouldn't ordinarily reach through the more traditional ways. And so I personally just like a month ago worked with an organization that is working with faith-based organizations around the country, going and providing the training, the language, the stigma, just and understanding what the services are. And so that is work that we're doing, and we're really looking on how we can expand that work across the state. So I'm really glad you brought that up, because that is something that we are actively working on, and we think is a really important part of the community that hasn't necessarily been included in these conversations. But it's such an important resource in communities and should be part of that conversation.